All right. So good morning, everyone. So we want to continue with respiratory system history taking, how to take history concerning the respiratory system. And before I proceed, I want to apologize for the technical errors that are there. Uh, the video is becoming silent, like there's no volume towards the end. So we'll see how we can try and improve on that. So like I've said, we want to look at the respiratory system history taking. So we've been looking at history taking, respiratory system. Okay. Yesterday we did an introduction to respiratory system, right? In terms of history taking, where we looked at some of the diseases of the respiratory system and the symptoms that those diseases can cause. So we try to classify or divide those diseases into various groups, that is infectious and non-infectious causes. When we talked about infectious causes, we talked about bacterial, we talked about viral, we talked about fungal, and we can also have parasitic infections. Okay. Then under non-infectious, we talked about allergies, we talked about autoimmune, we talked about hereditary or congenital. We also talked about neoplasms, which can be malignant or benign, right? So those are some of the diseases of the respiratory system. And then we talked about the symptoms of the respiratory system. We mentioned things such as cough. All right, we also mentioned things such as difficult breathing. We talked about things such as hemoptysis, that is coughing up blood. Then we also talked about things like wheezing. We talked about chest pain. We also talked about hoarseness of voice, um, fever, weight loss, okay, and so on and so forth. So all those are the symptoms of the respiratory system. Now, like I mentioned in the previous video, that is from yesterday, these symptoms are not entirely caused by the respiratory disease alone. Okay, they can also be caused by other systems, diseases in other systems, such as the cardiovascular system, the GIT, and so on and so forth. All right. So, in a clinical setup, okay, in a clinical setup, in a practical setup, we approach these symptoms in a different way as what we are doing here. Okay, because here it's more of theory than practical. Okay, so what I want to emphasize is that in a clinical setup, you don't only focus on the respiratory conditions or diseases alone. Okay, so you also look out for possibility of that particular symptom being caused by a disease in any other system. For example, if you're talking about chest pain, then you should also think about other systems. After looking at the respiratory system, you also look at other systems such as the cardiovascular system. Okay, for example, angina, which is cardiovascular disease, can cause chest pain. All right, you can also look at things like the musculoskeletal system. Okay, we know that things such as costochondritis can cause chest pain. Okay, we can also think of GIT problems. We know that things such as acid reflux can also cause chest pain. Okay, so you have to approach it in such a manner that you exhaust all the other systems that can potentially cause that particular symptom. Okay, so but for the purposes of this discussion, which is under respiratory system, we're going to restrict ourselves to diseases of the respiratory system, unless otherwise you can try to mention other causes from other systems as well. Okay, so that is how we're going to approach. Now, the other thing that we are going to try and do is stick to the topic, that is history taking. Okay, we'll not try to go into deeper things such as pathophysiologies and so on and so forth. Okay, we'll not so much go into those, and um, that is going to be for later discussions, and also trying to look at so much of what can cause this, what can cause that. We'll try to restrict ourselves to history, and then as we proceed with these lectures, we're going to look at pathophysiologies and causes of various symptoms and so on, right? So that's how we're going to go about today's lesson. Okay, so let's try to list the symptoms that we had yesterday again, right? And then we can proceed from there. So we talked about the symptoms that we talked about. Okay, we have one, we have cough, and two, we have a sputum. Okay, then three, we have dyspnea. Then four, we have hemoptysis. Okay, five, we have chest pain. And lastly, lastly we have wheezing. Okay. Now we also have others. Okay, these ones that are classified as others. Okay, constitutional symptoms. Basically, constitutional symptoms. Okay, the basically constitutional symptoms. So here we have things such as hoarseness of voice. Then we also have fever. We also have weight loss. Okay, and night sweats. Okay, so these are the symptoms that we have under respiratory system. Now, as you are asking questions, okay, as you are asking questions, when a patient comes with any of these symptoms, right? If a patient comes with any of these symptoms in a clinical setup, then you are going to start thinking of all the causes in all other systems. But in this case, you start thinking of all the respiratory conditions that can cause these particular symptoms. For example, if a patient comes with cough, then in your head you have a list of differentials of all the conditions that can cause cough. Okay, and then as you start your questions to the patient, you're going to start eliminating some of the conditions that are less likely to cause that particular symptom. Okay, for example, if a patient comes also with dyspnea, okay, then you start also to think of all the causes of dyspnea in this respiratory system, causes of dyspnea. As you proceed, as you continue asking your questions, you're going to be eliminating some of the causes of dyspnea. Okay, that's how we go about it. Now, the other thing that, like we mentioned from the previous lectures that we've had so far, okay, we should understand that in history taking, we talk to the patient, or rather, we ask the patient without using medical language or medical jargon. For example, if you look at things such as hemoptysis, okay, hemoptysis, that is a too big a term for a layman, okay, it's too big a term for a layman. So instead of saying hemoptysis, you can ask about coughing up blood, okay, coughing up blood. Then things such as dyspnea, you can say difficult breathing. All right, difficult breathing. Of course, we'll look at all these in a bit more details. So you don't use a medical jargon as you are talking to the patient, okay? Because patients and they don't fully understand some of those things unless otherwise. Okay? But it is always advisable to avoid medical jargon because it is going to create communication barrier between you and your patient. Okay, so let's look at history of cough. All right. what we should ask about, okay, we should ask about one, the duration, okay, the duration or onset of the cough, okay, duration or onset of what? Of the cough. So you want to ask how long or when did the cough start? When did you start coughing? Okay, or how long have you been coughing? So A, the questions is going to tell you the duration of what? Of the cough. Okay, now why is it important for us to ask the duration, for us to know the duration of the cough? It's important to know the duration of the cough because we are able to tell the chronicity of the underlying condition. If we know the duration of the cough, we are able to tell the chronicity of the underlying condition. Now, when we do that, it means that we're going to divide the causes of cough into two. Okay, we're going to have acute cough, or rather, we're going to classify it into acute cough and chronic cough. Acute cough and chronic cough. Now, under acute cough, all right, under acute cough, what we have is we can have those conditions that are arising from the upper respiratory tract, okay, from the upper respiratory tract. Okay, upper respiratory tract, we can have things such as, for example, common cold, okay, common cold. This is going to cause cough, right? And we can also have things such as sinusitis, okay, sinusitis, okay. Even things like foreign body, even foreign body may cause cough, okay. Foreign body can also cause cough. Okay, so you pardon me, I'll always be trying to allow some people that are joining into the meeting whenever I hear a notification. Okay, then we can also have lower respiratory tract, okay, causes. All right, lower respiratory tract causes. Now, what we're saying is that common cold will not cause. By the way, let me mention this before we proceed further. To say that acute cough is cough that is lasting less than 3 weeks. Okay, anything equal or less than 3 weeks, it is classified as what? Acute cough. Then chronic cough, usually if it is beyond 8 weeks. Okay, cough that is beyond 8 weeks is classified as what? Chronic cough. Okay, so you can see that common cold cannot does, or rather does not usually present with a cough that is lasting more than 3 weeks. Okay, because the reason is that most of these are they may be self-limiting. Okay, the cough may be self-limiting, or the cause of the cough may be self-limiting. Okay, or it begins, or rather it starts quite fast, okay, and then you can get even treatment as soon as possible, and that condition may resolve within the shortest possible time, okay. Then under lower respiratory tract causes, we can have things like pneumonia and bronchitis, okay, pneumonia, bronchitis, okay, bronchitis, even bronchiolitis, okay, um, even acute exacerbation of COPD, okay, acute exacerbation of COPD. Other than that, we can also have things like irritants, okay, anything that can cause irritation. Let's say, for example, you breathe in some toxic fumes and so on. You may find that you begin coughing, and you don't expect that you're going to be coughing for more than 3 weeks, right? Okay, you cannot cough for more than 3 weeks. So that is about acute cough. So when you ask the duration of the cough, when you find out the duration of the cough, then you classify the cough as either acute or chronic. Now, what can cause chronic cough? Okay, what can cause chronic cough is a COPD. Okay, COPD can cause chronic cough. TB can cause chronic cough. Even chronic bronchitis. All right, and things such as lung cancer. Okay, bronchiectasis. Okay, all those can cause cough. Even things like interstitial. Okay, interstitial lung disease, interstitial lung disease, and also drugs. Right, drugs. The commonest example that we have is the angiotensin converting enzyme inhibitors. Okay, angiotensin converting enzyme inhibitors, they cause cough, okay, which may be chronic. Now, why are we saying it's going to be chronic? The reason is that, for example, these are hypertensive patients, okay, and you want to treat the hypertension, you give them angiotensin converting enzyme inhibitors, and then they start developing this cough, okay. Most of the times they may think the cough is due to something else other than the drug that they're taking. They may even go to the hospital or the clinic. Maybe they even given some drugs to treat the cough, but not subsiding, okay. Until later on, maybe you discover that maybe it's because of the drug that they are taking. Okay. Here also we can have some irritants. Okay, some irritants can also cause chronic cough. So what are we saying? Just from this point, a patient comes with cough, all right, and then you ask your patient, how long has the cough been there? When did you start coughing? The answer that they're going to give you will make you decide whether you are dealing with any of these conditions under acute cough or you're dealing with conditions under chronic cough. If the patient says, I've been coughing for 1 week now, you're going to start thinking of these conditions here. That is under respiratory, right? If they say I've been coughing for let's say 9 weeks, then you're going to start thinking of these particular conditions under chronic cough. Okay, so that is how we approach a patient. All right, that's how we approach a patient. It's very interesting. It's very interesting, and